Thank you for joining me about this lecture with hyperbaric oxygen therapy. My goals in this presentation are to give you a brief review of the history of hyperbaric, understand where it comes from and what the concepts are, explain the physiology of hyperbaric, how it works, and the options of the different chambers available, as well as the benefits in veterinary medicine. Once upon a time in the past, in about 1662, there was a British clergyman named Henshaw. He used a system of bellows to change the atmospheric pressure in a sealed chamber called a domicilium. Now, Henshaw used both hyperbaric and hypobaric environment. He believed that hyperbaric environment would be better for acute conditions, and hypobaric environment were more appropriate for chronic condition. Now, Henshaw was only providing an increase or decreased air pressure. He was not actually working with oxygen concentration. Oxygen, you see, was not even discovered until 1773 by the Swedish pharmacist Carl Wilhelm Scheele. And the term oxygen wasn't even coined until about 1777 by the French chemist Antoine Lavoisier. In about 1834, there was a rebirth of the hyperbaric, so cycle comes up again, trend is back, and the French physician Junot built a hyperbaric chamber to treat pulmonary affliction. He was using at that time pressures of 2 to 4 atm, and he reported increased circulation of internal organs, improvement of cerebral blood flow, and production of feeling of well-being. In 1837, Pravache built the largest hyperbaric chamber of its time, and it was used to treat patients again with pulmonary condition, things like tuberculosis, laryngitis, tracheitis, pertussis, cholera, conjunctivitis, deafness, rickets. In 1860, the first hyperbaric chamber in North America and continent was constructed, and this was nowhere else but in Ontario in Oshawa. Later, that chamber was moved to New York and was used to treat what we call nervous condition. The big step with hyperbaric medicine was in 1877 when the French surgeon Fontaine built the first mobile hyperbaric operating theater. He had this huge operating room that he took advantage of the basic laws of physics like Henry's laws. Now, Henry's laws state that the solubility of the gas in a liquid is proportional to the pressure of that gas over the solution. This chamber was recommended to facilitate the reduction of hernia and for patients with asthma, chronic bronchitis, emphysema, and anemia. Over a 3-month period, 27 operations were performed in the mobile hyperbaric chamber. It's a huge success. An amphitheater was planned for 300 people, but this never came into being because Fontaine unfortunately died from an accident at the Pneumatic Institute and was considered the first physician martyr to hyperbaric medicine. Later on in the USA, about 1921, at the end of the First World War, Orville J. Cunningham in Lawrence, Kansas, decided to treat the Spanish influenza epidemic, and then he was using this atmospheric pressure or barometric factors that he thought were responsible for the higher morbidity and mortality of those located in higher elevations. One night, there was a mechanical failure that caused a complete loss of pressurization of his fancy hotel, and all of Cunningham's patients died. He went on to treat diseases like syphilis, hypertension, diabetes, cancer, and he believed that anaerobic infection played a role in the etiology of many of those diseases. We forward a few years, and in 1928, Cunningham built the largest hyperbaric chamber in the world in Cleveland, Ohio, and you see it right there on the screen. This was really a hyperbaric hotel. I mean, nothing was spared in that institution. The 5-story high steel sphere was about 64 feet in diameter. Each floor of this massive hyperbaric sphere had 12 bedrooms with all the amenities of any good grand hotel. The growing awareness of Dr. Cunningham's treatment prompted repeated requests by the Bureau of Investigation of American Medical Association to validate these claims regarding the effectiveness of hyperbaric therapy. Like everywhere else, there's always some people to put sticks in your wheels. So whether you believe or they believed at the time that he didn't want to share or cooperate with EMA, or whether they believed that this was a total fraud what he was doing, the point is the chamber was ordered to be dismantled in 1937 and sold for scrap metal during World War II. Then we move forward to people like Drager, that was the first to explore the use of pressurized oxygen in decompression sickness. His protocols were put into practice by Benke and Shaw, and this was like around the late 1930s. In 1939, a great pivotal point for hyperbaric medicine was the U.S. Navy began treating divers suffering of decompression sickness, and they used the hyperbaric oxygen chamber and therapy. This was very different than the previous uses of hyperbaric therapy, which only used compressed air. So here's in the late 1950s and early 1960s, we used HBOT or HBO, depending how you want to label it. Hyperbaric medicine basically came into strong effect and became quite prominent. In 1950s, a cardiac surgeon named E.T. Borema in the Netherlands worked with the Royal Dutch Navy with the idea of what we call flooding the body's tissue with extra oxygen. His result was so successful that a large operating hyperbaric chamber room was built at the University of Amsterdam, where he would perform a number of complicated heart and lung procedures. Borima and his team were the first ever to treat clostridial myonecrosis, better known as gas gangrene, with hyperbaric medicine. They used experimental pigs for that purpose. Borema also published Life Without Blood. This was a report of fatally anemic pigs treated successfully with hyperbaric oxygen therapy. And these pigs were able to thrive in a hyperbaric chamber even with the complete absence of circulating red blood cells. You can imagine the value of this for anemic patients and their supportive care. A little bit more brief history. The Undersea Medical Society, an organization made largely of Navy and ex-Navy physicians, was founded in 1967 in US of A. The Undersea and Hyperbaric Medical Society followed, and to this day is probably the mothership and overseeing force over the hyperbaric medicine. The Committee on Hyperbaric Oxygen Therapy in the late 1970s was also formed and systemically reviewed all the available scientific evidence for hyperbaric medicine. They came up with a list of conditions as well for which hyperbaric oxygen therapy was likely to be beneficial. This list was accepted by insurance providers, including Medicare. 1972, Dr. Richard Neubauer opened the Ocean Hyperbaric Neurologic Center in Lauderdale by the Sea. Still open. Neubauer is considered the grandfather of hyperbaric oxygen therapy in neurology. As well, Dr. Paul Harsh began an in-depth study of brain decompression illness, and I invite you to go on his site, and if you just Google Paul Harsh and hyperbaric medicine, and you'll see some amazing testimonial videos of the work that can be achieved with hyperbaric medicine. He spent a lot of time evaluating divers with the disorders of decompression illness, and he realized that it was not residual gas being treated rather than ischemic brain injury. In 1990, the former microbiology professor Igor Gamov invented and patented the Gamov bag. The low pressure, this time low pressure, hyperbaric bag provided a high altitude climbers with an effective method to treat high altitude sickness or AMS. These are very famous bags. You can still see them online, and as a matter of fact, a lot of families, a lot of people can buy them for their own personal use at home. They're designed to fit about a single person inside, and this portable hyperbaric chamber, they are pressurized with a foot pump, or you can use an oxygenator, or you can hook up actual oxygen tanks to it, not liquid, but regular. And with the bag, it stimulates a descent of as low as about 7,000 feet. So these bags are very much still alive and actually are being quite commercialized. Unfortunately, not regulated, so you need to be careful. So, how do you do that? What makes hyperbaric so wonderful? Well, there are some physics. I'm going to go over them, and then you're going to forget them, but at least we'll have gone over them. They are four major laws of physics that we work with in hyperbaric medicine: Boyle's law, Charles' law, Dalton's law, and Henry's law. So we also already went over Henry's law. The partial pressure of gas dissolved in a liquid is equal to the partial pressure of gas exerted on the surface at equilibrium. And then we talk about Boyle's law, which is the volume of gas is inversely proportional to the pressure under constant temperature. Charles' law is a little bit of a spin on that. It's for a body of an ideal gas at constant pressure. The volume is directly proportional to the absolute temperature. And then we have Dalton's law, where the sum of the partial pressures of gases in any mixture equals the total pressure, which makes sense, of course. The rationale behind hyperbaric oxygen therapy relies on oxygen transport. So, oxygen is transported at 97.5% via hemoglobin and about 3.3% roughly, or 3% roughly via plasma. In 100 ml of blood, there's about 19.5 ml that are passing to capillaries, which leaves you to about 5 ml back there at the end of it all. The partial pressure of oxygen at 40 millimeters of mercury and 75% oxygen saturation. As you increase the atmospheric pressure, you increase the plasma concentration and you increase the delivery to mitochondrium and other cellular organelles. So here's a little bit of a diagram for you. So we see that the oxygen can be 100 times more present in the plasma than it can be by the limitations of the red blood cells and their hemoglobin oxygen carrying capacity. Patients can survive with no red blood cells and only plasma oxygen. It's just pretty surreal when you think of it. Unfortunately, they can only do that in the presence of highly concentrated oxygen. So, small little problem. Delivery of oxygen to hypoperfused tissues will limit the ischemic damage, cell death, and inflammation. It's promoting collagen synthesis and angiogenesis, huge concept for wound healing, which actually hyperbaric medicine became most anchored in our field of medicine now because of the need for wound healing and alternatives to amputations and losing members. It also leads to decreased lactate and decreased acidosis. Another very important component when you have animals in shock, post-surgery, pre-surgery, and there's many, many factors. And actually, they're now finding in people that doing a pre-surgery hyperbaric treatment can prevent things like dementia and other ailments. So generations of oxygen-free radicals is something that comes up all the time. So we have these free radicals, and they're supposed to be really bad, and we're pushing this oxygen that's going to create free radicals. What happens? Well, the free radicals actually are going to be killing the oxygen-dependent bacteria and going to facilitate oxygen-dependent transport of antibiotics. So in the scheme of it all, even though there are some oxygen-free radicals, there's still some benefits to those. And then the next part of it that we need to understand that there's some vasoconstriction that happens. So that will limit the adhesion of leukocytes and degranulation. It will also decrease edema. Again, very crucial perioperatively. The increased oxygen tension that is present leads to angiogenesis and increased antibiotic delivery. And of course, you got the shrink the bubbles principle, which is an ancient sort of view of hyperbaric. So let's take a look at this table right here. Oops, I'm going to go back. There we go. So we have hyperbaric oxygen and its effect. Inhibits neutrophil adhesion to the endothelium cell, decrease interleukins and tumor necrosis factors, and on and on. Enhances, inhibits the expression of TLR4, and we have also the increase in brain tissue partial oxygenation. We have the inhibition of permeability of some of the membranes. We have the decrease of endothelin, improves blood velocity as well, which is, by the way, very important when you have blood sludging, things like polycythemia vera and so on. Reduces inflammation, inhibits apoptosis, which is important, especially when we're going to talk about cancer, reduces intracranial pressure, and you have also promoting neurogenesis and angiogenesis. So hyperbaric oxygen therapy is extremely useful in so many facets of our bodies and our disease principles in combating this. So hyperbaric oxygen also is a therapy that works, as you know, under pressure with the oxygen concentration. We are mimicking a dive, minus the water, of course. So if you observe the chart, you can see that right now where we sit is about 1 ATA, roughly. And then so when we're going in the chamber, we're already kind of at 1 ATA. And we're going to add, roughly in animals, 1 ATA. So when we go at we'll talk about this a bit more, but at 7 psi added, that adds a half ATA. When we go to 14.7 psi, we have 2 ATA. So a dive at 2 ATA is equivalent to a scuba diver going at about 66 feet roughly, but of course, we're just adding 33 feet underwater when we're in the chamber because we already are at 1 ATA. I hope that makes sense. So 1 plus 1 equals 2. Most treatments in hyperbaric are performed at about 2 ATAs. In the old days, things were being pushed up to as high as 3 ATAs. There are situations where you need to treat deep wounds for long periods of time and for greater depth. In humans, this is certainly more common. Humans do not seem to respond as well as our canine and feline species, and therefore the dives are longer, and you have to be super careful and follow the dive tables because you can have some serious decompression issues otherwise. They use a lot of things that we call air brakes as well in humans because breathing oxygen, pure oxygen for extended period of time and at too great depth can actually give you some oxygen toxicity and lead to seizures. Doesn't seem to be a problem for us because we use the chamber for a limited period of time and we use it at lower depth, so we don't seem to have as much of an issue. We tend to restrict ourselves to about 1.75 to 2 ATAs, and although we were initially treating 45-60 minutes of actual at depth, we are now finding that we get pretty much the same result at about 30 minutes at the depth. All right, so let's take a look at some of the timing effects. If you have an immediate versus the late effects, the immediate effects of hyperbaric is reperfusion of the dead tissue. And the late effects is, of course, wound healing. And that's the big box as far as human medicine. And in between, you have all this inflammation and infection that is being managed by hyperbaric. So what are the risks? So nothing is without complications, right? What can possibly this great wonder of oxygen cause? Well, there are risks. There's still risk, of course, in anything we do. Patients have to stabilize with the dive. They have to equilibrate. So there is no respiratory disorder that really can be put in there in humans. If you have some problem with inner middle ear, it's not recommended because you can't decompress, you can't stabilize, you can't equilibrate as you're quote-unquote diving. So some of these patients, for us, we dive at 1.75 or 2 ATA. That's not a really big deal compared to going at 3 ATAs. And our dogs and cats seem to figure it out pretty quickly. As a matter of fact, I do treat a lot of inner middle ear disease with hyperbaric with great success. So oxygen poisoning is something else that we can see, oxygen toxicity, and those, as I said, occur at higher ATAs. Changes in visions have been noted. There's a lot of questions about the possibilities of increasing cataracts and causing some issues with glaucomas. There's a lot of research being done in the visual field with hyperbaric medicine because hyperbaric oxygen therapy is super helpful for healing ulcers, especially those ulcers that have very resistant bacteria. Some of the side effects also can be very mild and for not very long, so that's important to know. Usually people recover from this. The therapy does not last more than 2 hours for most of the human counterpart. For us, as I said, about 30 minutes at depth with the dive and the resurfacing, it's under an hour. Some cautions to take. There are certain types of lung disease because they have increased risk of collapsed lungs or issues that we can't put in there. Bullets. Having a cold or fever can be an issue in humans. So the cold is for decompression. We don't tend to deal with this as much. In matter of fact, I treat a lot of nasal disease with hyperbaric. But the fever can be an issue because it makes them more prone to having seizures. So you have to watch out a true fever, not a mild hypothermia, but a true fever, and that has to be checked off as yes or no by your safety director. They have any history of ear surgery or injury in people is a no-no. For my patients. I have treated many patients with ear surgery and Buller disease, and I've been very happy with the results. We also know that some people don't like small spaces, and of course, some of our animals don't either, although that's pretty rare, but is the occasional claustrophobic dog. In that case, we can sedate, but most of the time, we don't have to. So, in the humans, what is hyperbaric oxygen therapy approved for at this time? The logic, air and gas embolism. Of course, that's a diver's injury. Carbon monoxide poisoning. Perfect treatment. The only treatment really is oxygen. And if you put it under pressure, you're going to dislodge the carbon monoxide a lot faster, recuperate a lot faster, and correct any potential brain damage that can be a consequence of carbon monoxide poisoning. Of course, gas gangrene, as we mentioned, crush injuries, compartment disease. So when you have fractures, very important to get these animals under the hyperbaric as soon as possible. Highly recommended because in people it's more of a last option, more of a rescue thing, and we found that if we can do this early, we have much better response. There's even some thought now that it would be ideal to put patients in hyperbaric prior to surgery for these wounds, as it helps they decrease the edema and the swelling and gives you a much happier tissue to heal with and to work with. Decompression sickness, of course, arterial insufficiency, severe anemia, makes sense. Intracranial abscesses, absolutely. Trying to get penetration of all these antibiotic and treat non-air breathing or the anaerobic bacteria. I cannot find my words, my apologies. And necrotizing soft tissue infections, osteomyelitis, delayed radiation injuries, compromised graft and flaps. And again, I go back to now the more current literature is looking at incorporating hyperbaric with plastic surgeries and other reconstructive surgeries, because finding that this is a huge assistance in speeding up the healing early on and avoiding the compromised graft. Acute thermal burn injuries, of course, and very, very quickly treated with hyperbaric if they start going south. And any idiopathic sudden sensory neuronal hearing loss has been considered. Some of the things that are being looked at as well are much more expensive, but not on the list of written off by the insurances. Autism, cerebral palsy, Lyme disease, and other polyarthritides, migraine, multiple sclerosis, near drowning, recoveries from plastic surgery, sports injuries, strokes, traumatic brain injury, PTSD, dementia, Alzheimer's, post-anesthetic dementia, fibromyalgia, ALS, DM for us, pancreatitis, polyarthritis, and on and on and on. All right, so what are the types of chambers that are available to us? This is the one I was telling you about, the Gamma bag. So this is the one that's all over your Amazon, your shopping from medical supplies, and it's pretty cool. And this is an oxygenator that you have with it. So they often give you the oxygenator if you buy this chamber, which can be anywhere from $5,000 to $10,000. You're going to reach about 1.3 to 1.4 ATA. So for most cases, that's not enough. If you're going to treat something chronic, something deep tissue or brain involved, not enough. But there are many people that use these chambers and swear by them. There are people that have kids with cerebral palsy, with autism, and swear by the use of this oxygenation for their kids. One of the things you need to be careful is that there can be problems. So you need to make sure you don't let your kids sleep in there all night and don't be monitored, because the oxygenator could break down, there could be issues, and then of course, not a good news in the morning. But these are alternatives, and when people are desperate, when people have a great need to try to save their family member, help the quality of life, sometimes that's all that's available, because hyperbaric medicine is to be prescribed. It is a drug, and it has to be prescribed by a physician, and not all physicians want to prescribe it for your kids, especially off-label, as it is their license. I mean, after all, their license to write a prescription gives them the right to write it off labels, but it also can put them at risk. All right, so this is 1 ATA. And then this is 1 ATA. So in the chamber, as I mentioned, when we add pressure, this is what we get. So to get the proper pressure, then we fall into these categories. This is an acrylic chamber, Pretty standard looking human chamber, monoplace. There's a phone to talk to them. There's a pressure gauges. And the door opens one swing. The gurney slides in, slides out. So the patient is grounded with a special wire. You have all these ports up here which allow passing of ventilators, monitors, and so on. The patient goes in there. The pressure is initiated, monitored. You go to your depth. Usually takes about 10 minutes or so to go to depth. And then you go ahead and stay there, come back up about 90 minutes later, and voila. This is a multiplace chamber. I say this with some hesitation because it's clearly not very comfortable. But in this chamber, the whole chamber is oxygenated and under pressure. The nice thing is that you can actually use the space to treat. It's not the most comfortable and has to be accommodated, but at least it's an option. Here's an official multiplace chamber. Now these kinds of chambers can run 1.5 million and up, so obviously they're not for everybody. They're usually for massive hospitals. In this situation, the patients are wearing a mask, and it's not a hood, it's a mask, and I'll show you what a hood looks like in a minute. They sit here, they wear a mask that's breathing oxygen, and the chamber air is pressurized. You have an operator here. Now the operator has to be careful with all the dives and be aware of what's happening. So there's an operator outside and there's an operator inside as well. And the person that's inside has to be careful with the dive tables or they can run into trouble. So usually in these multi-place chambers, there's 2 or 3 operators per day so that they can go ahead and switch on who's diving so they don't go over the dive tables. Here's another type of multi-place chamber. Here's your operator here without a hood, and everybody else has a hood. That's a flexible hood, and once the oxygen pressure goes in there, it inflates the hood, and the chamber itself is pressurized, but the patients are breathing the oxygen through the hood, which makes it a bit more economical, as you can imagine. Here's what's really not hyperbaric oxygen therapy. This was developed actually by Paul Harsh, I believe, as an attempt to treat superficial wounds with superficial oxygen. It's better for you to actually breathe the oxygen to get it to go systemically. This has some effect topically on the wound, but it's not going to give you the same effect. So we don't recommend using these kinds of equipment. Equine chambers, these are some of the chambers that have been used. Some of them successfully, some of them did not do well, as you probably have heard the stories. There's been one equine chamber in Canada that went south and one in Florida. And 2 places I've been, by the way. And but the horse can be in there and without any metal, with no shoes, and the operator is on the outside. There is a visual hole in the door that slides around and the horse can be in a safe place. Here's another equine therapy. This one is a multi-chamber, oops, moving my picture, where you have the horse going in and another horse can go right on the side. The operator is with the horses, and this is a mask of oxygen that the horse breathes oxygen through, and the chamber itself is pressurized of air, and that's going to go ahead and give them similar treatment in multiplace in people. Here's an example of the Seacrest chamber for small animal. Seacrest is a major producer with Perry of human chambers, monoplace chambers particularly, and they're trying to break into the market of the canine and feline and companion animal. So they have built this with acrylic, similar model to humans, smaller. There's a phone in case you want to talk to your dog, which is kind of cool, I think. But the door, very simple hinge door, so that's very convenient, easy to open and close. The patient's on a gurney, so you have to ground the patient because it's on a mat, and that usually involves putting some kind of grounding on the patient directly attached to the skin. Here is the chamber that we use at Alta Vista, and the one I'm most familiar with is hyperbaric veterinary medicine. They actually just started the 2nd generations of chamber that they're releasing at the VMX this year, right now. This is a tray, and you'll see, I'll show you how we use it, but the tray, the patient goes on the tray, goes in, and these screw-on latches will close the door. All right, so how are we going to set up a treatment? Let's go for a dive, shall we? So we have a computer system and program that connects and has a whole series of treatments that have been used in the past listed. So we put in first patient, sometimes second patient, because we have pods, I'll show you. We go ahead and make sure we enter the doctor, the operator, the depth, and the time. So this was from my clinic in Florida, so you can see that we treated at longer periods of time then, and now we find it's not really needed. It will also to ask you what you're treating for each patient, so you can keep a log. Here we go. This patient had a pancreatitis. This is a French bulldog. This was our setup in Florida. It's the same here, so feel free to come and visit. So we have a tray that we've pulled up. This is an acrylic pod with holes. The patient goes in. The towel is only here because there is sometimes some leakage of urine, and it allows us to minimize our cleaning. So we often put a small towel right by the exit so we can manage the cleanup. The patient is being wet down. We have a small hand towel that our technician is using to wet down the patient lightly. It's to avoid static electricity, particularly important in cats. So the key thing that you have to realize that when you're looking at the chamber, people think it's going to explode, it's going to make boom. To have an explosion, to have a fire, you have to have fuel. Well, in this case, it's easy. You got the dog's flesh or the person's flesh. You have to have oxygen, which clearly we have. And then you have to have the ignition. And this is what's missing. And this is what we must make sure is always missing. So no lighters, no smoking in a chamber, no static, although static has only been recorded in one, I think maybe two accidents in all the history of the chamber. No metal that will go cling, cling, cling and start a spark. If there are implants, they need to be wrapped. No nail polish, no creams, ointments that are going to be petroleum-like, that can cause a reaction or heat up and cause burns. No hair clips, no e-collars other than plastic transparent ones. And we recommend usually only cotton for materials that are going to be in there. There are discussions that cotton is very flammable, so why? And the reason is that it is probably the least damaging of all fabrics you could put in there. Discussions as well about plastic from the IV lines and whether we should be using those elastic tubes in there. It is an issue in people that have long-term catheters because oxygen can disintegrate the plastic. Not an issue for our patients because they rarely have the catheters more than 3 days before we have to change them. So in Florida, we used to wrap with cotton cash padding. This is vet wrap under. Now, from experience and from having gone to the safety course, I can tell you that we do not need to wrap with this cotton cash padding. However, it is important that you just wrap the catheter or put any collar so the dog doesn't start chewing it, because it is in the chamber alone. You can't access it. If it chews this catheter, start bleeding everywhere, it's going to be quite a cleanup. Patient is then being put in the cage and the lid is being put on. It slides down in the grooves. We are moving the first crate of acrylic pod back. And then we're ready for our second patient. So this is in the case we're doing 2 small patients. The alternative is to do 1 big patient. Again, we can see our little pee towel, as we called it. And we close the door. And the treatment starts. So post-treatment, we're going to remove the patients one by one. We check the temperatures, pulse respiration, pre and post-treatment. For some cases, blood glucose has to be checked as well, for example, diabetics. The hyperbaric oxygen will potentiate insulin, so it will definitely cause the blood glucose to go penetrate more into the tissue, so we have to make sure they don't come out hypoglycemic, Addison's cases, and for example. We're going to clean the pot and the tray table with peroxygard or chlorhexidine dilute solution. We're going to file the patient's monitoring form, scan them, and prepare for the next patient. So pretty simple. All right, let's go over some diseases. Let's start over the non-neurological veterinary applications. So first things first. Here's a list of things. Spider and snake bites for wound healing. They're the big ones we had in Florida. Bite wounds, left and right. Of course, hit by cars, lashes, and so on. Skin grafts, very big one. Degloving injuries, dental disease, post-dental, stomatitis are all on the list of frequent of what we consider wound healing. So let's take a look at dog bite. This is the dachshund that presented to our ER and was arriving at a facility with these gashed on big dog, little dog, and cleaned up under anesthesia, management of pain. And the next day, the doctor on emergency had closed the wounds on both sides, and we put the dog in a hyperbaric chamber. But within 24-48 hours, wound started to dehisce. Closing the wound without proper debriding or appropriate drainage can lead to complications, as we all know. So question is, you want to use Penrose, that's all you have? Great. If you can have some proper suction draining, probably more adequate and more appropriate. So the infection takes over, gets a dehiscence. We have to do cultures. We clean up. Honey, sugar, wound bandages at the time is what we opted for, which clearly that dog liked a lot. Just kidding. I just like his face that way. 4 days post, this is what we have. We have an amazing granulation. We have daily cleanup, and we have totally debrided the edges, and you can see a nice, fresh, beautiful flesh after only 4 days. We have all the skin, of course, that dehisced, that was taken off. Still on systemic antibiotic. The patient is very comfortable, is continuing his hyperbaric oxygen therapy, and he's getting it twice a day at 2 ATAs. We're on day 6, and the wounds are just about ready for us to close or begin to think about grafting. This is a redundant granulation, which will have to probably be removed, a little bit of proud flesh, as we call it in horses. We need a bit more healing tissue. Continue with the hyperbaric and our bandages. This is on day 15. We are ready to close. At that point, we have a perfectly wonderful contraction that's starting. This is in surgery. We've done the skin flap, and this is the other side that's going to be flapped as well. Whoops. Let's go back to where we were. And here we are, 2 weeks post-surgery, 1 month post-trauma. This is what this dog's incisions and scabs look like. As I mentioned earlier, hyperbaric medicine was pretty much thrown into the world of our current modern medicine because of wound healing and difficulty with wound healing. And everything else it can do is now being explored into, and it is quite a new wave of medicine. And I guess the old is new again. Huh? Skin graft. Here's an example of a couple of difficult grafts. They were at the elbows of 2 different dogs. One of them had a cancer. The other one had just a simple pressure sore that kept having bleeding and issues, and the dog licking it, so the owner's wanting it gone. Both of these received skin graft after removal of the mass and no complications. Hyperbaric oxygen therapy for 90 minutes at 2 atmosphere, 5 to 10 times. And they healed beautifully. Snake bites. Very common in Florida. We have breeding season in the fall, and this is when we get most of our patients show up with snake bites. Here's a patient that I thought was pretty extraordinary. Shows up to our clinic with a very swollen face. I hope you can see how swollen his little face is. His little Roman nose. He was treated with IV fluids, anti-venom, laser class 4 to help with fibrosis. And we use also pentoxifillin for management of these bite wounds and working with the necrosis that can happen. Arnica montana for trauma, and then put in hyperbaric oxygen therapy at 2 ATA every 4 to 6 hours. This particular patient received overnight 2 ATAs. So here's after the first treatment. You can see that his nose is still swollen on the tip as a divot. You can see how much better he looks as far as a face view. Pain is well managed. We've stopped IV fluid. We repeated the laser treatment once a day. Here how he looks after the second hyperbaric therapy, and he went home within 24 hours. These 2 dogs went as lucky. Here's the guilty party, snake, that bit 2 dogs. Interestingly enough, after eating a prey, still had enough venom to bite these 2 dogs one after the other. And those two family dogs got bit on the face, went to a different ER, and were treated with antivenom twice, IV fluids, anti-inflammatories, and later on were admitted at our hospital for the hyperbaric. They were given one extra shot of antivenom and admission, and hyperbaric therapy started immediately as well as laser. The patients 24 hours later, you can see significant change in the size of the swelling, but still quite a bit of damage to the eye. This patient actually developed thrombocytopenia, which can be a biphasic secondary complication to the snake bites, and she developed the biphasic form and responded very well. Here's the patient undergoing laser therapy, got to wear protective eyewear. 48 hours later, you can take a look at brown and white dog is looking much better, still having some difficulty with the eye. Our brown dog that was all necrotic in the mouth and the face is recovering beautifully. The swelling substantially reduced. Comfort is definitely there. We're looking on day 4. Brown dog went home. Thrombocytopenia worsens for the brown and white dog. Continued treatment in hospital with plasma as well. Supportive whole blood due to the anemia that followed. And hyperbaric treatment was continued. The brown dog came on that patient. And here it is, 47 days later, 4 for the brown dog, 7 days for the brown and white dog. They went home and were perfectly happy and never looked back. These dogs probably would not have made it without hyperbaric. So we have some recent papers published 2018 that were increased efficacy of antivenom combined with hyperbaric oxygen therapy in envenomation. And you can see that these are very important combination to speed up the healing from snake envenomation. Spider bites, recluse bites are very common in Florida. This is what they look like. So some people don't have much of a reaction to them, and then sometimes when you fall in a nest, this is what can happen to the elbow. And this was a bite that morning, seen at another emergency, that completely deteriorated in less than 12 hours and was rapidly sent to us for the hyperbaric oxygen therapy. So second day after we started hyperbaric treatment, here's the hawk, looking beautiful and fleshy and nice and lively tissue. We have finally infection that ruptures in the elbow area. Yes, I know those are Penrose drains. I like them, use them, they worked well. Probably could use something else. Absolutely, suction drainage would be fabulous. This is the recluse nest patient day 2. We have cleaned up the elbow substantially. It's a big gaping hole now. And here's our lovely hawk that's healing wonderfully. This is right after hyperbaric. Day 3, continued healing of the elbow area. We are flushing, packing. Here's a finger going right through with sterile glove. And here is the hawk, beginning to show some contracture already on day 3. This is day 6. We had a secondary infection start up on the hawk. So yes, another Penrose drain goes in. I know, no comment. And then this is the level of the elbow. We are now pulling those drains in the elbow. This is day 16. We developed a hygroma from laying on it. The elbow is closed and cleaned. So the hygroma was managed. And essentially, day 21, everything is cleaned up. Osteoarthritis is another problem that we've treated a lot in Florida. So here's an example of a dog that was treated for spider bite. The owners liked the treatment because it made the dog feel good. They decided to come back. She was a little lame and stiff from hip dysplasia, some elbow issues, old golden. They just wanted the therapy for her to feel good. And what we realized is that when we suggested adequate as well and laser, so we did adequate injection, laser, and hyperbaric on the schedule of the adequate, which is polysulfate aminoglycans, and this dog started running. So owners were super happy. Here's another patient that went through one treatment of hyperbaric, and you can tell the owner had a full gear for helping the dog get up and walk. And this is after the first hyperbaric treatment. That's pretty impressive. Pancreatitis. Many articles supporting the treatment of pancreatitis using hyperbaric as an adjunct. Very important. pancreatitis, hepatitis. This is my very own dog, Tommy, that survived pretty nasty liver disease and biliary disease and pancreatitis for over 2 years. I credit a lot of that to the hyperbaric oxygen therapy treatment that he got. Metastatic cancers. This is a very big wave right now in hyperbaric medicine. So we are beginning to treat a lot of the metastatic cancers with hyperbaric as a additional solution. So here's Edward Charles Goldfinger, my very own cat. Yes, over the years I've had many patients. Has been treated for lymphoma of his GI with chlorambucil every 2 weeks, and the days he got a chlorambucil, he got his hyperbaric treatment. The prednisone was only given when he was in hospital because I'm a terrible owner, and that's the way it is. The schedule was every 2 weeks, as I said, and his survival was over 2 years before we started to see him come out of remission, and eventually we needed to start a different therapy. I opted to not continue at that time. But Edward, I do believe, lasted over 2 years with zero complication, no steroids on a daily basis, hyperbaric and chlorambucil every 2 weeks, an excellent quality of life, and I think a lot of that had to do with the chamber. So non-toxic metabolic management of metastatic cancer in VM mice has been reported, the novel combination with ketogenic diets as well. The ketone supplementation and hyperbaric oxygen therapy work together. This article published in 2015. Other common uses in vet med, you got post-op pre-op orthopedics, anemia, immune-mediated disorders, pneumonias, and so many more. Dermatitis, otitis, stomatitis, those are all things that people are exploring now. What about neurological disorders? Of course I have to put a dachshund there. So this is the video. I'm not going to go through it. You can find it under Mr. Paul Harsh. I will show you some very brief clips of it. So here we go. This is a young man that in June 2004, Kurt Allen, was in a car accident. He was comatose, had brain surgery, was in intensive care, was admitted to the rehab center and permanently dismissed 3 months later for failure to improve. So the video begins in October 2004, and I'm going to move you forward. So here you have Kurt with Dr. Harsh. So Kurt does not have the ability to respond. You'll see Kurt has a very hard time writing himself. Kurt does not follow stimuli. So as we progress through time, this is Kurt, 90 treatments later. Yeah, I know it's a lot of treatments and a lot of months, but this is somebody that was condemned to never being able to walk again. So there he is. This is very difficult to do. Put their feet together. Kurt walking. So if you have some time, it's a very long video, but if you have some time, please take a look at it so you can see how fantastic this young man is doing and being able to go back to his regular family life. Brain trauma and hypoxia. Here's a patient post-anesthetic arrest presented to us. No good response to light. Was placed on an oxygen nasal tube. Nasal insufflation. Not really responsive to nociceptive stimulus. This patient had arrested during a dental anesthesia. This is after the 4th treatment of hyperbaric oxygen therapy. Patient received 10 treatments and went home. Was avisual at the time he went home, but recovered vision within about 2 weeks later. Hyperbaric oxygen therapy improves spatial learning, improves cognitive dysfunction by reversing it, and then ameliorates local brain metabolism, amongst the many articles out there. So here's a little Morkie that also had an anesthetic complication. 3 months after its complication, the owner came to us having heard of the hyperbaric and was interested in seeing if it would help. The dog was non-responsive to toys, treatment, playing, was circling all the time. There was not the dog that she'd had. She was pretty desperate to get her dog back. And this is after it received 10 treatments. The dog is able to gather its toys on the mat, is playing with the owner, guarding its toys. Even though we told the owner the dog was doing outstanding, she decided to continue treatment for another 5 treatments and continue to report amelioration. So I think this is fantastic. And you'll see our little dog choosing its toys and protecting them. Brain cancer. This is a big one for me. I love neuro-oncology, so here's a case: 6-year-old male domestic short-haired cat diagnosed with a nasal lymphosarcoma that has invaded the brain. This kind of prognosis carries about an average 87-day survival with treatment. You've got brain herniation right here. The owners had a difficult time deciding what to do as the cat herniated in my exam room, so they decided for immediate treatment and eventually MRI. Then when we got the results from the MR, they decided to go to surgery, whether a craniotomy, rhinotomy. We went ahead and cleaned up all the tumor we could see. We left the CCNU wafer and we followed with hyperbaric oxygen as soon as the patient was awake, and again the next day. This is the patient the next day after surgery. We'll take away the sound. This is less than 24 hours post-surgery. And off he goes, doing what cats do, which is find a closet. Kept treating him with decreasing doses of prednisolone. Then every 6 weeks he received CCNU at 50 milligrams per meter square, orally, and hyperbaric treatment. This is him a few months later, video that the owners posted on YouTube and sent to us. Clearly the cat has gotten all its functions back, digging into the I don't know if it's what, Bud Light, Miller Lite, can't tell. And then playing with his buddy, his new friend Oliver, little puppy Chihuahua. 6 months later, repeat MRI, no cancer. 1 year later, no cancer. Miko unfortunately passed away of a diabetic disease, and the owners were away when the diabetes came and showed up as a crisis. It had been going on, I'm sure, and it wasn't caught. And the general practitioner got Miko in ketoacidosis, and the owners opted for euthanasia. So hyperoxia resensitized chemo-resistant human glioblastomas. Hyperbaric oxygen is adjunctive treatment to treatment of malignancies, including brain tumors. This is something that I wish to pivot on, as I like to look at treating gliomas with chemotherapy and hyperbaric oxygen therapy in combination with ketogenic diet. So at this time we have 2 patients under care, and hopefully we'll be able to continue following them. Intracranial inflammation. Dog with GME showing up with tremors, neck pain, very subacute onset, obtundation, falling over pain. Here is the CSF tap. You can see, I will play these videos so you can enjoy the view. So you can see the type of cells, a lot of polymorphs in the CSF. There's no question this is an inflammation. Brain abscesses and inflammations are treated with hyperbaric as an ancillary treatment. This particular dachshund went home the next day, treated with steroids and hyperbaric, and went home that night, sorry, not the next day, and never looked back. The last little thing that I want to tell you about is degenerative myelopathy. So degenerative myelopathy is the sort of the animal model for ALS, Lou Gehrig's disease, and I am very interested in treating degenerative myelopathy with hyperbaric oxygen therapy. I think the basic principles pathophysiology is fitting. I have a corgi in the past that I've treated and a German Shepherd dog. German Shepherd dog responded somewhat, but had also some pretty pronounced hip dysplasia and also some lumbar disc problems. So I don't know which one was causing issues. With the corgi, there was no other ailment. We treated with 5 hyperbaric treatment at 288 90 minutes. That was our standard protocol then. We got some improvement in strength. We also tried to treat him with stem cells after, which actually was not a good idea. The patient did not really improve after the stem cells, perhaps even worsen due to maybe injection. We're not sure. But here's this dog after its first couple hyperbaric. This is before we did a stem cell. And doing pretty darn well on his back legs for being a DM. So no worsening for a few weeks, and believe that hyperbaric oxygen therapy work as it's promoting stem cells in vivo may promote stabilizing the patient. Mechanism is to be considered, and I'm very interested in following up with that, hopefully with our local population here in Ottawa. Other neurological disease, of course, FCE is an infarct, very validly treated with hyperbaric. Discal spondylitis helps penetration of antibiotics. Pre- and post-op disc spinal injuries. Neuro-oncology, immune-mediated polyradicular neuritis. Seizure management, radiation therapy. Hyperbaric oxygen therapy helps to protect the spinal cord for spinal cord injury, improves the environment after spinal cord injury, and attenuates neuropathic pain. All of these are to be taken into consideration for the multi-purpose and uses of hyperbaric. Dementia, this is my very own dog. Yes, I have many pets. Oliver Sacks is demented, and when he receives hyperbaric, he does outstandingly well. He has now 15 and a half years old, and I must say, since he's not gotten hyperbaric since January last year, and it has been a little bit more challenging, and I hope to get him back in the hyperbaric in the near future. So another project I'm looking at is the effects of dementia and on the dogs, and then if the hyperbaric can convert these dogs by using the senility tables that are currently available. So conclusion, hyperbaric can be a great ancillary treatment for a number of disorders. It is rarely a cure by itself, except in vascular disease, but it is not a cure at all, and not for all, is what I mean. The hyperbaric is a must in all hypoxic situations, strokes, FCE, spinal cord injuries, cancer management in combination with other therapies like ketogenic diet with hyperbaric can be a future for us. Degenerative disorders should be considered, and many humans are looking at the use of hyperbaric for treating many degenerative disorders, as I said, like ALS, Lou Gehrig's. And then stem cell therapy as a booster, I don't know how much I believe in that from my personal experience, but it's not a high number, so I think I'm still open to seeing the possibilities. Studies in the making, as I said, I'm interested in looking in hyperbaric on DM and looking as well pre and post surgeries for back injuries and others. I have an interest as well in chemotherapy for brain tumors with hyperbaric, with or without ketogenic, pain management, GME and hyperbaric, and of course, quite a few more interests. So thank you very much for taking the time to look at this video. Let's make the impossible possible for our best friends. And just remember that we learn a lot more by looking and not by knowing.